into summertime heat now and the possibility of heat strokes. What do you need to know? Well, we have the guy with the answers with us, Dr. Heinz Dueffer from Shelby Baptist Medical Center, joins us now to take your calls. Give us a call, 741-9272, to ask the doctor. First of all, just a general question. When do you know that you're having a heat stroke? I mean, what are the signs when we're out there in the summertime heat doing things? How do we know?
That's an interesting question, because the people who are actually having this heat stroke probably don't know they're having it.
Oh,
and it's the people who are around them who are going to notice that there's something not quite right. The person will be nauseated, they'll be dizzy, they might not be acting like themselves. And what happens is it's basically a loss of the body's ability to regulate its own temperature. It happens to people who are older, young kids, especially under 4, but it can also happen to people in their 20s. It's just a matter of environment, whether or not they have any underlying illness, anything like that.
Okay. We have our first caller, Tyler. Tyler, what is your question?
All right, so what are the symptoms of heat stroke?
So the symptoms of heat stroke are basically if you approach somebody and they're not acting right and they feel warm to you, they're dizzy, they're throwing up, they're nauseated, they're red, hot, dry skin, they're having muscle cramps or muscle weakness, lightheaded, headache, things like that.
But it's interesting, you said if you yourself are having the heat stroke,
many times you don't know you're having it.
You won't
because you're dizzy, your brain is not functioning the way it's supposed to.
Okay. So if we do see those symptoms in someone else, or have still have the sense and know that it's happening to us, what do you do about it? What's the first thing you do?
The first thing to do is to remove the person from their environment, the environment they're in. Get them to a cooler place. If you're outdoors, get them to the shade. You want to attempt to cool them somehow. You want to put a fan on them, get some air moving around them. You want to get some water on their skin, but not a lot of water. You want it to be able to evaporate, because that's how one of the ways the body cools itself.
Okay.
If you have ice packs, you can put ice packs underneath their arms, in their groin, kind of rub across their head.
Just get them cool as fast as you can.
Get them cooler and call 911, because this is an actual emergency.
We have another caller, Randy. Randy, give us your question about heat stroke.
Yes. At one time, I felt like I was having, I don't know, like chills and stuff like that, but I was pouring sweat.
So there is something called heat exhaustion, which is not quite heat stroke, but you're sort of headed that direction. People who are having heat stroke, they lose their body's ability to cool themselves, and sweating is one way that the body uses to cool itself.
I mean, I was pouring sweat and everything like that, and then I just fell out, and my chest was tight and hurting and everything.
So it's kind of hard to say, talking to you over the phone, what you might have had, but it sounds like you probably were headed that way.
We have one more caller very quickly. Ayana, what is your question?
My question was, if you have a certain type of sickness, do you need to stay out of the heat? Like, if you are weak all the time, if you take a lot of medicine?
That's a really good question, too. People who take medicines for, say, diabetes, high blood pressure, things like that, or any other kind of chronic illness, they actually have an increased likelihood of getting heat stroke.
So be careful.
So be careful if you have an illness, yes.
Doc, thanks for being with us.